Hey everyone, today I had made a video on mastectomy assessment. So like a 15 marker answer, what all positive findings you can write in theory exam. So let me start. What is mastectomy? So it is a surgical removal of the breast tissue. So first thing which we need to mention is demographic data. So you have to write about your name. So you can write like this, that name, it is for identification and record keeping. Then age, then you have to write gender, address, occupation. Same way you have to write about date of admission, operation and evaluation. If it is mentioned in the theory exam, like in theory question, then you can write that. If it is not, you can just write the importance of it, like as I said. And main important thing here is gender. So it is very commonly seen in female in compared to male. Next thing comes as chief complaint. So chief complaint, the patient mainly will be having pain. So pain would be over the incision side, and because of this pain, the shoulder movement, especially the abduction and extension and flexion 90-degree would be reduced. Okay, there may be patient might be having tingling, numbness in the hand because of axillary web syndrome. Now what happens in axillary web syndrome? So when there is removal of the lymph nodes, so at that time there is a tight cord like structure which restricts the movement. Okay, and the third thing, it could be that patient may also have complaint of heaviness in the hand because of lymphedema. So because of heavy hand, patient will be feeling ekdam heavy on the affected limb. Okay. Next thing is history. So in history, first thing always start with present history. So you have to write that there may be any of the following reason because of which patient has underwent for mastectomy. So it could be carcinoma or it could be tumor. Okay, these are the two commonest reason why people go for. So you have to write like this. Then next thing is past history. So patient might have underwent for any radiotherapy. Okay, any radiation therapy patient might underwent for that. So you just mention this much. Then very important is pain history. In pain history, first thing which we write is side. So which side it has been operated, whether right breast tissue or left breast tissue, you have to mention that. Then side, so pain will be over the incision side. Which type of pain? So mainly dull aching pain would be. Okay, duration, it would be acute or chronic, depends on which case it has been given. If you have been given post operative day 2 or 3, it is acute case, right? Then onset, it would be a gradual onset. Okay, aggravating factor, shoulder movements. As soon as patient will do any shoulder movement like abduction of the hand or something, patient will be having pain. Okay, if patient cough, right, if patient cough, there would be pain over the incision side. If patient sneeze heavily, the patient will be having pain. So what all the relieving factors would be that the pain would be reduced when the patient is in when patient is having analgesic, then patient will be having good feeling, right? And when patient is on rest, right? Intensity you have to take by visual analog scale. So you have to mention the grade like 0 to 10. 0 is no pain, 10 is maximum pain. Always draw with pencil. Okay, and just mention this much. Then you can write about medical history. There might be hypertension, diabetes, cholesterol. You can write those things. Family history, it may be present, it may not be present. Drug history, yes, the patient might be on antidepressant drugs, immunosuppressant drugs. Then other histories which you could mention is surgical history, occupational, socio-economical and personal. See, if it has been given in the question, then you can mention those things, or you can just write the importance of it like surgical history to know that if any previous surgery has been. Okay, so on observation, you have to write about general condition, whether it is good, fair or poor, body build, endomorphic, mesomorphic or ectomorphic. It won't be mentioned in the question, then you just mention all those three. Then you write about posture. So because of the incision and incisional pain, patient will try to be into slouch posture. Because if patient extend himself, then there would be a stretching of the incision, right? And it will cause pain. So patient will develop a slouch posture. So you might see in protracted shoulder and kyphosis, and it may be also because of their habit of sitting. Okay. Next thing is gait. So on observation, when you observe gait, so there would be arm swing might be reduced. Okay, you can mention this part. Then scar. So yes, scar would be present over the incision site. So mainly incision which is done on the for mastectomy, it is aclip incision which is done. Edema would be present in the arm and hand. Swelling would be present. trophical changes might be redness, shiny skin might be there. Okay, very important is prosthesis. Like patient might be having an artificial breast implant after the operation, might be, okay. It is not necessary, but it may be. Then facial expression, patient might be having depressed facial expression. Why? Like because of social, like patient will be having like underconfidence, patient will be thinking that what the society will think, will they accept us, right? So because of that, it might be patient might have facial expression depressed. Next thing is on palpation. So when you palpate, you will see that there would be scar, and scar over the incision side it will be present, and whether it is healed or non-healed, that is adherent or non-adherent, you have to mention. Okay. Then edema. Edema is present over the hand. If edema is present, whether it is pitting edema or non-pitting edema, you have to mention. Temperature, you have to mention that it would be raised over the incision site. Tenderness would be present, and sometimes if it is just post-operative day 1 or 2, patient may not allow you to touch because the patient will be having too much of pain. Okay. Spasm might be present on the muscles, especially like neck muscles or your shoulder muscle might be spasm. Okay, so you can mention in theory exams. Now, very important thing is on examination. So first is psychological examination. So patient might be depressed, patient might be having irritated behavior, patient might have mood swings, anxiety. Okay. Then scar examination, you have to take the site, that is incision site. Second is you have to measure the length, and you have to write whether it is healed and non-healed. Okay. Now third very important thing is range of motion. So it would be affected, okay, it would be reduced on the shoulder joint, okay, because of the pain and because of axillary web syndrome or because of lymphedema, it would be reduced only. Okay, so you have to always check that part, and always check one joint above and below. You have to mention these lines. Okay, like for example, if the patient has taken a right side, always make such charts, okay, where you have to write about right and left, where you write about active and passive. Just write which all movements you are checking, like shoulder flexion, extension, abduction, adduction, internal rotation, external rotation, and write that if right side has been operated, there would be reduced, left side it would be normal. Okay. Then next thing is strength. So strength would be obviously reduced on the affected side if the patient has undergone like modified halted mastectomy or something. So there would be reduction of the strength, especially where pectoralis would be affected. Okay. Otherwise, there might not be affection of the strength. Okay. And yes, grip muscles, gripping, that is hand muscle, also might be reduction in the strength. You can write that also. Then respiratory examination. Now because of the incision, there might be incision pain, there might be patient would be having, and because of the posture adaptation, patient might have reduced chest expansion at all the three levels, that is at the xiphus sternum, at the nipple level, and at the sternal level, right? So it might be reduced. Then you have to write about girth. Yes, on the lymphedema side, like if the patient has been like done on the right side of the right side, if mastectomy has done, so on that affected, like on that right side, there might be presence of lymphedema, and so it is necessary to take girth measurement, so it would be increased. Okay. And the last thing in examination is functional assessment, where you have to, before patient is leaving the hospital, you need to measure the functional assessment, where you have to write 6-minute walk test you will take, and there might or might not be fatigue and reduced endurance. Okay. Now, next thing which you have to mention is ICIDH-2, that is International Classification of Impairment, Disability and Handicap version 2, where you have to write about impairment. Write two headings like this: structural and functional. So structural impairment, what all structure would be affected? So your breast tissue and the lymph node would be affected. And in functional, the pain would be there. There would be reduced range of motion and strength would be read. So that is a functional impairment. Then what all activity limitation patient will be having? So patient won't be able to do overhead activities. Okay, like if she want to keep anything in the above cupboards, okay, or above any drawers, so it would be difficult for her. Then like difficulty in combing hairs or dressing upper body would be difficulty. Then difficulty in lifting heavy objects, would be because of incision pain it will occur. Okay, so these are activity limitation. Then next is participation restriction. So patient may avoid social events, like because of psychological trauma and social rejection, or because of, like mainly social rejection would be there, and she might not feel confident about herself. So that may be a restriction. Other than that, there won't be any other restrictions. In contextual factor, you can write facilitator and barrier, where you can write family support and friend could be a facilitator if they are supportive people nearby, and if she is confident, then it would be helpful for her. But if there is no support, then she might be getting depressed, right? So it wouldn't be a barrier for her. And the last very important thing is PFD, that is physical functional diagnosis. So you have to write that whatever, if the name of the patient or age is given, then you have to write that like XYZ 45-year-old female has underwent for mastectomy, okay, on the right side, and has difficulty in doing ADL activities. She has reduced range and strength, okay, and presence of lymphedema. So you have to write. So in always PFD, you have to mention the detail about it, okay, overall detail about the case which you have written. So yeah, that's it. I hope this assessment give you a basic guidelines idea that how to write an assessment format. I hope it is somewhere helpful to you guys.